Hi, I'm Shashank Bhargav, and you're listening to Three Things, the Indian Express news show. The number of confirmed COVID-19 cases in India have now crossed 2.5 lakh. This makes India the fifth worst hit nation by the pandemic. Now, even as cases continue to rise, it is important to note that most COVID-19 patients don't require any medical intervention. In fact, on average, only about 25% of the active patients require hospitalization. And out of that, only 5% require ICU beds, and even lesser number require ventilators. But for hospitalization and critical care, India is relying heavily on private hospitals. For example, the majority of hospital beds in the country are actually in private hospitals.
Right now, 70% of the inpatient department, which constitutes hospital beds, the ventilators, the ICUs, is with the private sector.
That's Kaunain Sheriff. He reports on healthcare and law for the Indian Express.
And if you want to talk about the outpatient, that is, whether it's your testing, whether it's your consultation, that is 60%. So the fact that we know that every 7 out of 10 hospital beds are in the private sector, so it becomes very important for them to participate in the pandemic right now.
But having to rely on private hospitals during this time has put many patients in a difficult position. Early on, not wanting to be associated with COVID-19 and blaming lack of proper protocols, many private hospitals had shut shop. And many even now are refusing to admit both COVID and non-COVID patients. Some patients have had to chase 12 to 13 hospitals before finally getting an admission. This is in part because of the lack of availability, but definitely not in all cases. Though the other problem that patients face is when they are admitted in a private hospital. And that problem is the money that they end up paying, which for a COVID-19 treatment can be a lot. In this episode, we are focusing on this problem. We will try to understand how private hospitals end up charging huge amounts of money, why that is especially concerning during this crisis, and what the government can do about it. When we spoke to Kaunain, he pointed out that one big problem is that because this is a new disease, there is no standard procedure for it.
First thing, we need to understand that COVID does not really have a specific treatment. So we really don't know what kind of treatment you would get when you want to get admitted in the hospital. It's just based on the symptoms that you have. That means if you have comorbidities, then you will be treated to the comorbidities. And if you have a lung infection, then you'll be treated for the lung infection or pneumonia.
In other known diseases where we have found their cure, we know what specific tests to do and what medicines to prescribe. And we therefore know how much it will approximately cost. But with so much unknown about COVID-19, the cost can really vary, especially when you have comorbidities, that is, other illnesses or diseases along with COVID-19, like diabetes or a heart condition, for example. Less than 2 weeks back, Kaunain had examined the hospital bills of 6 COVID-19 patients admitted in private hospitals. Its findings were revealing.
The biggest takeaway from these bills were that people who are comorbid are ending up paying a huge amount. It could vary from something like 3 lakhs for a week, and it could go as high as 16 lakhs for a month. So because there is no specific treatment, you are paying so much.
Then, like we mentioned, there are many unknowns. One being the medicines being used.
So people are paying a lot for the medicines because there is no specific medicine. So there are what we call as experimental treatments that are being used right now. So these are very, very costly.
For example, an experimental drug named tocilizumab is now being used for COVID-19 treatment. And one dose of this drug can cost between 40 to 60,000 rupees.
The second aspect is the PPEs, which are under controversy right now. The cost of them varies from hospitals to hospitals, and you're ending up paying somewhere like 3,000 to 15,000 per day. So we really don't know how many PPEs are actually being used by the entire team.
Kaunain says that these bills reflected that professionals from different medical departments had been attending to patients, and all of them had to use PPEs.
It could be someone from critical care who's monitoring the ventilators. There could be doctors from the chest and lung department to check the pneumonia and lung infection. So that becomes the big component.
He says that some states have tried to cap the prices, but this capping has been limited to beds.
And the bed cost becomes a very, very small component. It is the medicines, the consumables, And in consumables, it's the PPs which becomes the largest unknown cost inflating the bill. But however, I need to add one more thing. The ventilators has become a big issue right now. That's the biggest cost if you are going into the ICU.
The ICU itself can cost between 7,000 to 15,000 rupees per day. But after being admitted to one, you also incur other charges.
Maybe just for a test to check whether what the oxygen level is ranging from 1,000 to 5,000 per day. Then you'll have a consultation charge which ranges from 2,500 to 6,000. Then any small procedure that is conducted in an ICU, it ranges from 2,000 to 5,000 per day.
And then just for monitoring, the cost is as high as 3,000 rupees. These costs have come as a big burden also because of the current economic crisis. Many have lost their jobs or have faced salary cuts. Hospitals overcharging patients is not a new problem, of course. And when we spoke to Malini Aisola from the All India Drug Action Network, she pointed this out first.
Even prior to COVID, there was a growing awareness of this problem about unethical and exploitative practices of private hospitals in overcharging.
The All India Drug Action Network is a group that has, for a number of years, been working on issues related to affordable healthcare and more recently has been assisting COVID patients across the country. Malini is the co-convener of the group.
And an agency called the National Pharmaceutical Pricing Authority had in fact exposed how hospitals were inflating the pricing of medicines, consumables, and devices, which together make up a huge portion of an inpatient bill. So that practice we find is still continuing even during COVID, whereby the hospitals are preferring the brands of the medicines and consumables and devices that provide the highest commissions for the hospital. And of course, then that creates a larger bill for the patient.
These bills, when it comes to COVID-19, like we discussed earlier, include the cost of PPEs, experimental drugs, and mandatory tests, all of which can vary hugely. Apart from this, there is also money that some hospitals demand upfront.
Practice of asking for huge deposits. So we have had cases where they have been asked to put down deposits of 5 lakhs and a host of new charges such as, biomedical waste disposal, various other charges of that sort. But what is interesting to note is that even in COVID, where we don't have any specific treatments that have been identified, everything that we are following right now is either based on old protocols of dealing with influenza, but there are no specific treatments at the moment. Even for moderate cases, even for cases that require a basic admission, you could end up spending as much as a surgical intervention, equivalent of what you might pay for a surgical intervention.
In some cases, that could be several lakhs. Malini says that in one case where the stay was prolonged, the cost was 16 lakhs. Now, one way this cost for the patient can be reduced is through insurance. But the problem is that because the costs associated with COVID-19 are so high, they end up depleting the entire insurance for the person. So if a patient has other health issues, they can't use the insurance money for it in the future.
So we had a case like this where the person had cancer, and there was certainly a concern because she had an admission for COVID. After that, there was going to be less insurance coverage for her to deal with the remaining cycles of chemotherapy and treatment that she was going to need the rest of the year.
Often, people also have health insurance that covers the entire family. In that scenario, if one family member uses it for the COVID treatment, there's nothing left for the other members. Recently, the Insurance Regulatory and Development Authority of India came out with a proposal for a separate insurance product for COVID-19. The draft requires hospitals to cap, among other things, the price of rooms and ICUs. Though it is only after insurance companies start selling this product that we'll find out to what extent it will actually help. Meanwhile, though, there aren't many options available for those who have been overcharged by private hospitals.
Before COVID, patients have faced challenges in accessing traditional redressal mechanisms, which have ranged from approaching the consumer court, medical negligence committees, or even the police. But now, during COVID, with the increased restrictions, patients are certainly having a much, much harder time to voice grievances and get any resolutions. And we really have to remember that this is a public health emergency, which means that patients just don't have the time for lengthy resolutions. So appeals to the hospital directly or to the government for help are about the only realistic options in the current scenario.
This time has been tough for hospitals too. With people delaying hospital visits and elective surgeries, many have faced a loss in revenue. But Malini says that they have focused too much on their bottom lines and have been lobbying for bailouts.
But most worryingly, they have actually been trying to subvert attempts of state governments that may be trying to bring in some form of rate regulation or requisitioning of the private facilities to provide some relief to the public. And also the treatment of patients that we have seen during the pandemic is very disturbing, because you would imagine that the private hospitals would be more empathic and not harass patients or follow the same form of exploitative pricing that they were in the past. But we haven't seen any change in that behavior, unfortunately.
The Supreme Court, for its part, has put pressure on the government. In its 8 April order, it asked the centre to ensure free testing at private labs for all Indians. But then it later changed it, saying that it should be free only for the poorest of the country. This came after Solicitor General Tushar Mehta, representing the Indian Council of Medical Research or ICMR, filed an affidavit against the order. The court since then has asked the government whether COVID-19 patients who are not beneficiaries under the Ayushman Bharat scheme can be treated in private hospitals at the same subsidized rates that the scheme offers. And why can't private hospitals which were given land free of cost treat COVID-19 patients for free? To which the government has replied that the Ayushman Bharat scheme was only meant for the poorest of the poor and that it had no statutory power to direct private and charitable hospitals to give free treatment to COVID-19 patients. So the question is, what can the government do about this problem? For this, we spoke to the former Secretary of the Ministry of Health and Family Welfare, K Sujatha Rao.
Government has never made any attempts to control pricing in the private sector, except in Karnataka when they brought out a law about 3 years ago, and they wanted the private sector to display their price chart. And that was it.
What she refers to here is when Andhra Pradesh had tried to endorse and implement the Clinical Establishment Act in the state. The act was passed in the parliament in 2010 and aims to safeguard patients' rights and provide a set of standard treatment guidelines for common diseases and conditions. The act was passed by the centre, but since health is a state subject, most states have not implemented it.
Then all the private hospitals went on a little bit of a strike, but they protested and all that. And finally, even that clause was removed in the final act.
In Andhra Pradesh, the pushback had been largely about transparency. But Rao points out that price capping doesn't even find mention in the Clinical Establishment Act or any other act.
What government can do, and which then becomes sustainable and reasonable, is to say that we want you to treat X number of patients for these conditions, and this will be the amount that we will pay you and reimburse. And you're not to charge anything else from the patients.
She says to do that, we need to have agreed treatment protocols and do a proper costing of what will be charged.
Because otherwise, if you just simply reimbursed the amount that private sector was charging, they could unnecessarily use a ventilator when there's no need. They can just put somebody in the ICU when there's no need. So there can be several kinds of procedures or practices which may not necessarily be required for, say, a mild case of COVID. So in order to rule out any such overbilling or any such overtreatment or any such unnecessary treatments and jacking up of prices, we need to then come up with a treatment protocol which the private sector would then have to follow in the treatment of the COVID cases, and a certain amount of price range can be provided depending on what the actual case-to-case situation is that can be reimbursed by the government.
She says that the government should treat this as an opportunity to work with private hospitals and come up with the right policy framework.
But there is a lot of homework that the government has to do with great clarity. I mean, just see how muddled that test case was. I mean, you put a ceiling of 4,500 rupees for a test. And then later on, after 2 months, you say, sorry, that's not the amount. It should have been much lesser. It can be done in 1,000 rupees.
The ICMR had first put a price cap of 4,500 rupees on the RT-PCR test. But then, late last month, it removed that price cap. In a letter to all states and union territories, ICMR Director General Balram Bhargav said that the price of the tests were undergoing reduction and the upper ceiling of 4,500 may not be applicable now. This indicated that perhaps the price cap of the test could have been lower to begin with.
I mean, that means care was taken to come up with a reasonable costing, and you just did it probably by taking the case from some private hospitals who might have told you that that's what it costs.
She also says that the price of the tests could have been reduced if the government had planned for buying them in bulk.
Which is what happened in the States when they negotiated. They were able to get the private sector to do it at 2,000 and 2,500. So that whole 4,500 had no basis, and nobody knows why such a ceiling was put in the first place by ICMR and on what basis. In other words, such pricing should cover their immediate costs, but not give any room for making profits. This is not the time to make money on a particular thing, because it's just simply not going to be affordable for anyone to afford market prices to be paid for COVID treatment. So that's not the intention. But the point is that you don't also get into a loss.
When we asked Malini the question of what the government can do, she pointed to things both in short and the long term.
So I would say the current reality is that the private sector is better equipped to deal with critical care. And therefore, the immediate need is for governments to devise mechanisms for utilizing the private sector without pinning the financial burden on the people. And because, again, health is a state subject, so delivery of healthcare rests with the state government. States are free to make these decisions and to lay out the exact terms of engagement with the private sector during the pandemic.
The other thing she recommends is framing policies and legislations to curb the unethical practices by the private sector.
And to begin with, they can at least develop an oversight mechanism and enforce it strictly. And I think then talking about post-COVID, in a post-COVID situation, there should be more of a focus on boosting the public healthcare system, be it in the form of infrastructure, personnel, or equipment. And I think the experience of the pandemic shows us that the burden primarily falls on the government.
She also points to India's spending on healthcare, which has been historically low. According to WHO data, the government's expenditure on healthcare was just 1% of the GDP in 2017. This placed India at number 165 out of 186 countries in terms of government expenditure on healthcare.
So there is a dire need to increase the spending on health and direct funds to strengthen the public health system.
Malini has also filed a petition in the Supreme Court on behalf of the All India Drug Action Network and the Jan Swasth Abhiyan Mumbai, which is also a network of public health groups.
And through our intervention, we have brought to the court's notice the efforts of the various states in India that are trying to provision care through the private sector and the variations in the different models that have been adopted. We have also provided hard evidence of overcharging and hefty bills that COVID patients have experienced in the last several weeks. And importantly, what we are asking for is more systematic requisitioning of private healthcare capacity as per the need. So different states may have different needs. And also for COVID treatment to be made free for everyone.
The challenge here, she says, would be to fight back the corporate lobbying against it.
For example, even right now in the Supreme Court case in which IDAN and another group, Jan Swasth Abhiyan Mumbai, have intervened, there are two hospital associations, Nat Health and AHPI, that have also intervened. And they are definitely resisting any kind of regulation of the charges for COVID treatment. So we wouldn't be surprised if, again, they fail at coming out with any regulations that would be addressing the issues faced due to private sector exploitation and overcharging.
You were listening to 3 Things by the Indian Express. Today's show, as always, was edited and mixed by our producer, Joshua Thomas. If you like the show, then do subscribe to us wherever you get your podcasts. You can also recommend the show to someone you think will like it. Share it with a friend or someone in your family. It's the best way for people to get to know about us. You can also tweet us at Express Audio and write to us at podcasts@indianexpress.com.